back, MTP number 55. We're going back to back today because I'm so far behind. Like I said, I'm trying to answer as much as I can on the internet. There's questions that definitely grab my attention. And there's this one fella, and I feel real bad for him, Joe R. Okay, Joe R, who has had some problems. Okay, and he's had some problems with an implant. And there's nothing worse than, getting calls because, I'm sure that my patients will call other urologists, and then when they see things that they feel aren't just perfect or are far from perfect. But as I've been trying to tell you throughout all 4 episodes up till now, find yourself a dedicated center and you're going to at least get your answers to the things that you think are not good. And this gentleman is really, really upset, and he says, please read, all the terrible things that happened to him. And there's a few things that I want to address, okay? Because I'm not going to ever make an assessment over the phone or even until I examine somebody on somebody else's job. And for the most part, dedicated centers do an amazing job. I would say 99%. And when we fail, we fail not because of hubris, but because we're not infallible. But there's a couple things that you said, Joe, with all the complaints where I want you to, because it appears you're still early in this process of having a penile implant, and you're talking about 2 things, okay? And you're talking about the head being floppy, and clearly you haven't watched MTP. I don't know which number it is, but we talk all about hypermobility, okay? The worst thing your surgeon can do is if that erectile body does not make it out to the glands, to make somebody happy just by making sure that the cylinders are in the glands, they would have to go through the normal anatomic end of that erectile body, which is not doing you any favors. So that glandular hypermobility is probably just your anatomy, and there's ways of addressing that, and I'm sure your surgeon will help you. The other thing that you were complaining about is your pump and how it's high in the sac. Well, was it high in the sac immediately after surgery? Because most surgeons that do this with any kind of frequency, they know where to place that pump, and it's your job to keep it there. Now, it's also their job to help you keep it there by seeing you post-operatively and giving it a good pull if you don't. Okay, so these are a couple of things that I can address. I understand, how upset you are, but realize that a few of these complaints very well could be things that, with a little coaching, a little bit of good rehab can be remedied. And that's the important thing, not another surgery. I want to sue this doctor. That's not the kind of stuff that I think we have to go into 99.9% of the time. Okay, so just some good hard work with your rehabilitation, and then just some good coaching on how to really utilize your implant, and I'll bet you we can get you so you're one of those 98% that should be extremely happy with your implant. I hate to be the Debbie Downer on this episode, but for everybody, Joe really, I think I got like 6 emails from him, so I wanted to address them. So again, find a dedicated center. Again, follow your post-operative instructions, and you should have an excellent outcome. And hope to see you again next week. See ya.